When it comes to protection, there are certain rules that need to be followed, and the first is never hold the film using your fingers. Unfortunately, large percentage of dentists, for the sake of, doing a radiograph and prevent repeating the radiograph, the first thing they will do is that they will hold the X-ray for the patient. This is if they are using the angle bisecting technique. Angle bisecting technique actually is an inferior technique in terms of image quality, and it carries the risk of overexposing patients because they are using their finger to hold or support the film or the sensor. But most of our dentists, at least the ones that I talk to, is that because they want to make sure that the X-ray is not repeated, so they will hold the film or the sensor for the patient. This is contraindicated. Even with the use of digital sensors, which require a minimum amount of radiation, again, you are unnecessarily exposing yourself to radiation because the patient comes to your clinic, say twice a year, if you're going to do an X-ray for him or her, but you're doing this job daily. Now, if you're going to keep on the practice of holding the sensor for all your patients just to prevent or assure that the radiograph is taken properly, this is completely contraindicated. If you're using the angle bisecting technique, then the patient should support the sensor by his finger. I suggest that you should do is that you use a sensor holder or a film holder if you're using the films. These will, as I said, will guarantee parallel lines, and you can refer to these the use of these sensor holders and other videos that are present on the website that you can check. If you don't want to use these, you can also use the disposable sensor holders. Again, this is present in another video. In all these instances, you and the patient will not be supporting the film, one. Second is that you will utilize the parallel technique, which by all means is better than the angle bisecting technique. As you can see here, the film is supported by the sensor holder, or the autoclavable one, or it can be used also by the use of a disposable one, so that after the X-ray is done, you simply get rid of this, and this is a single time use item, and then you use it. So using the patient's finger, as you can see here, to support the film will expose the patient's finger to radiation, okay? Plus there is a possibility of slippage, possibility of infection control. So all these will be lost, will be gone. And if you're going to use your finger instead of the patient's, again you're going to expose your finger unnecessarily, continuously to exposure. So rule number one, don't use your finger to support the film.